All right, so we continue our conversation here and pre-analytical errors, and we're going to look at some of the problems that we're going to encounter with the actual sites that we're going to be selecting. I know it's very easy sometimes to go for the first vein that you see, but you have to consider other things that may affect your results. So some of the problem sites that you might see are burns. Obviously, when somebody has a burn, yeah, it's pretty common sense that you're not going to be puncturing around there. But not only directly on the burn, but because when somebody suffers a burn, and any part of their body, especially their arms, they're going to be experiencing increased amount of circulation to the area. As the body tries to repair itself, there's going to be increased blood flow, increased fluids. So when you're going to collect from this area, you may have a what we call a hemo diluted specimen because of the amount of increased blood flow. So consider that before you puncture an arm with that, even if it's distally or cent- um, centrally towards the body. You have to consider those factors. Okay, veins that are difficult to palpate are, when there is swelling, obviously it's going to be a lot more difficult. Areas where you may have impaired circulation, there's no blood flow, it's going to be very difficult for you to obtain a specimen from that site. If there's a new burns, obviously you have pain because of the swelling. Now, a person that has tattoos, someone that just had a fresh tattoo, maybe within the last 24 hours, even if they do let you puncture around that site, which they probably won't because they just had a brand new tattoo, you will have problems because they may be at higher risk for infection. Okay, so it'd be very risky to collect it from there. So avoid those areas if it's a freshly new tattoo. Now, even if it's an old tattoo, when someone has an old tattoo and you puncture the area, and if that person happens to have some kind of bleeding under the skin, it's going to be difficult to visualize it because they almost look like a bruise. A bruise almost looks like a tattoo, so it may be difficult to catch it right away. It may evolve into a hematoma, which is one of the H words, which is a really a large amount of blood collection under the skin, which results in pain and may even result in obstruction or affecting the nerves of that specific arm. So if you have no choice but to draw in an area with a tattoo, try to insert the needle in a spot that does not contain any dye or very light dye so that you can obviously be able to detect any problems. Now, other problem areas you may encounter are damaged veins. Damaged veins are those veins that are sclerosed or hardened. How do those feel? When you palpate a vein, remember we're looking for a bouncy sensation. We want to make sure that that vein is nice and bouncy and that it's filled with fluid or blood. We don't want to try to collect a specimen from a vein that is hard. So don't get confused. Always look for that bouncy sensation when you're palpating for the veins, right? In patients, sometimes those sclerosed veins look very tempting. They're right there, they're sticking out, but they may be clotted or thrombosed. Okay, which is also not a good thing. You will not be able to get any blood specimens from there, and obviously they'll be difficult to puncture. So avoid those areas, those veins that are sclerosed or thrombosed, either they're hard or they're very clotted. Okay, use another side if possible, or draw away from it distally. Okay, so that you don't get any abnormal results from there. Other problem sites that you might encounter are edema. Edema is swelling caused by abnormal accumulation of fluids in the tissue. So results with fluid such as IVs, because sometimes the IVs that are on the patient's arms will infiltrate, or meaning the liquid will start leaking into the skin. So what you're going to see is a lot of swelling. You don't want to collect a specimen from the area. Okay, this will result in erroneous results, and it contaminates your blood specimen with all this extra fluid. Okay. Besides, when there is swelling, as I just said, veins are going to be much harder to locate, and the tissue is very fragile. It might you cause more complications such as a hematoma. So usually phlebotomists in their early morning rounds in the hospitals or in nursing homes, when they often go very early in the morning, they're the first ones to notice any edema or infiltrated IVs. If this is the case, you need to report it right away. And again, avoid any arms or collection of specimens from these areas that are infiltrated with IV fluids. Now, a serious complication that can also occur is a hematoma. A hematoma, as I said earlier, is a swelling or a mass of blood collected under the skin. Sometimes it trickles down very slowly and it develops over a few days. But this may often occur with two people that are taking anticoagulant medications. If blood takes too long to form a clot, when you release, discharge that patient from your site or your office or wherever you're at, and you do not apply enough pressure, right, for a while, they're going to be oozing blood. But sometimes it doesn't just ooze out, it oozes inside the arm when you cannot see. So if patient is taking anticoagulant medications, I always encourage you to maintain pressure for at least 3 to 5 minutes, even if they're not bleeding. Apply a small pressure dressing so that pressure can be applied to the area and minimize the amount of bleeding that's going to be inside the arm. If you don't, then you might have a large hematoma and a big problem uh, ahead of you. Okay, so make sure that you apply prolonged pressure. Again, if there is a hematoma already, right? How can you tell there's hematoma? Well, hematomas are very painful. When you try to palpate around and it's kind of bluish around there, avoid that area. Please avoid it because you may make it worse. Or if you do collect a specimen from a hematoma area, it's going to be contaminated with other tissue body fluids that are there already. So please avoid those areas as much as possible. Hematomas resulting from venipuncture, sometimes even they're very small, okay, or they could be very large. So please make sure you make any documentation, any incident reports if you notice the hematomas right away. Okay, they may develop very quickly or they may develop very slowly, especially if you accidentally puncture an artery. Remember, arteries pulsate, so when you collect your specimens, you're going to see blood squirting into your tube, or they may fill very quickly, whereas veins usually they'll fill very a little bit slower. All right, so make sure that you apply enough pressure on those and make any documentation now, not on the patient's record, but in a separate incident report. Problem sites and mastectomies. Females that have had a mastectomy in the past can actually have a serious problem because when you apply a tourniquet to an arm, let's say the female had a mastectomy, removal of the tissue, right? Of the tissue, the breast tissue. Uh, when you apply that tourniquet, what you're actually doing is applying pressure here, right? Limiting circulation, and it backs up down back to this side of the body. So you're going to cause increased swelling, which swelling causes pain. And in the end result, you may cause lymph flow to be obstructed, right? And the lymph nodes that are in this area of the arm, okay, it causes swelling, which may cause infection. And of course, that is a complication or a problem, right? So please make sure that you are aware the patient has not had any type of mastectomies in the past. By applying the tourniquet in this affected site can also change your blood composition, and as a result, you will have incorrect results or inaccurate results. Now, obesity can also be a problem when you're going to be collecting your specimen because veins may be a little bit deeper and hard to find, as you may experience when you're trying to palpate a vein. They're not visible. You really have to trust and gain experience and trust your palpation technique. It's not easy, but it does take a while to gain this confidence in yourself. You may use a longer tourniquet if you don't have the regular ones. They're too short. You can barely make a knot, or if they're rolling into itself and it's turning into a rope and you're cutting off circulation, you're going to leave a bad mark. So be careful with that. You can also try using a blood pressure cuff, which you can inflate up to 40 millimeters of mercury if necessary. Try the median cubital or cephalic veins if you're unable to see any veins or palpate any veins. Remember that median cubitals are the ones that are right in the middle of the antecubital area, and your cephalic is the one on the outside of the arm and goes to your head. Always avoid your basilic vein. Only nurses can collect specimens from vascular devices. So we're moving on to other vascular devices that you might encounter in the intensive care units. You're going to see a lot of arterial lines that are placed on patients, and these are placed on there because they need to be monitored. They need to closely monitor the arterial blood pressures. So they have these lines that are connected to an artery, which is usually the radial artery or the ulnar artery, and specimens can be collected from there. However, they have to be collected by a nurse. Has to be by a licensed professional. So when you do get these specimens, you are also going to have to make sure that you document that the specimen is a arterial specimen and not a venous. So therefore, we can use the ranges for arterial blood, not venous blood. Very, very important that you remember that. Okay. Arterial lines provide accurate and continuous measurement of blood pressure. Again, this is for more the medical management. Your job is to make sure that you give the nurses the right tubes in the right order of draw. Use a disc cart. Remember, if you're going to collect specimens from any kind of line, you will have to use a disc cart tube before you collect your other tubes. Right? Only nurses and other specially trained personnel are allowed to draw blood from specimens such as vascular access devices, arterial lines, PICC lines, central lines, and so on. The phlebotomists typically assist by supplying the appropriate tubes, and if syringe is used, transfer the blood to the tubes using a safety syringe transfer device, which we've done in the past. No tourniquet is necessary because the blood will automatically be used to draw. Usually, they use a syringe to pull the blood out from the arterial lines. Now, there are some patients that are on hemodialysis. They have a shunt or a fistula on usually the left arm, but they can also be found on the right. They're located usually in the antecubital area, sometimes in the distal part of the arm, and sometimes even in the upper part of the arm. So you have to be careful by simply asking the patients if they are on dialysis, if they have any surgical procedures on either side, may answer all your questions. So these shunts are permanent, okay? But many times they stop working for whatever reason. They get clotted or they just don't function correctly anymore. Many times they are left in place. It's better to just leave them in place. So if the device, the shunt or fistula is not being used, then you are okay. It is acceptable to collect blood from that arm, but not from the shunt itself, but from another part of the arm. Okay, these devices are placed in surgically, and it's fusing of an artery and a vein. Okay, so you have two types of blood flowing through those shunts. But again, you're going to be collecting blood from probably the hand or somewhere on the arm away from the shunt itself. These again are mainly done for treatment for hemodialysis, right? And as I mentioned, they're located in the back part of the arm, usually in the antecubital area. You can quickly spot them when you see like a bulging, like a bulge in the area of, it looks bulky. If you lightly palpate, if you put your hand over it, you're gonna feel like a little purring cat, right? When you feel a cat purr, you can hear like a very fine vibration. That's what they feel like. Okay, and when we use a stethoscope, we put it on here and we put the diaphragm on the fistula. You can actually hear the the bruit. We call it's a whooshing sound where the blood, the arterial blood, is being pushed through the fistula. You can actually hear it with your stethoscope. But that is for nurses to do. There are other vascular devices that you will come across. These are called portacats. These small devices are surgically implanted by a physician, obviously, usually on the left upper chest, but you can also find them on the right upper chest. These are usually connected to an artery or a vein. Okay, these portacats are used for long-term treatment, usually of chemotherapy. Instead of the patient having a risk of getting an infiltration with chemotherapy, which may damage the arm, they place these little, very small devices. So you only see a very small circle about the size of a quarter. Now, these devices are accessed, or we access them using a Huber needle. It's a 90-degree needle that is inserted into the catheter, and then we connect a small tubing connection that we can infuse medications. But we can also collect blood samples. So if a patient has a vascular device that is accessed, meaning there is a tube coming out and the nurse is there, you can ask the nurses to collect the specimen from there. Again, you will need to make sure that you collect a discard tube, all right? And then hand the tubes, assist the nurse by giving them the tubes in the correct order of draw. So you discard your red tube or your syringe, whatever device you're going to be using to collect your specimen. But again, remember, only a nurse can collect the sample. You as a phlebotomist are not allowed to collect directly from portacast or other vascular devices. If any infection comes up or anything complications happen, you're not liable or responsible for that. This is a convenience for the patient because you don't have to stick them. However, if the patient has a portacath but it is not accessed, then you will have to perform a venipuncture. Patients sometimes will tell you that they have the device and they want you to collect it from there, but you be politely have to explain to them that you're not allowed to collect it from there unless the device is accessed and it has to be by a nurse. All right. So remember that. Vascular devices such as IVs, where people get, hydration therapy, antibiotics, and so on, are usually managed by the nurses. It is not recommended that you collect specimens from here. Okay. Now, when we put an IV on a patient, usually a very small plastic catheter stays inside. We use a needle to pierce the skin to pretty much open the way for the catheter. Okay, we leave that little plastic inside and we withdraw the needle and then we tape it down. So once the catheter is in the vein, we use it again to administer the IV fluids or medications. It provides access for administering or even drawing blood. However, it's not recommended that you collect blood from here because many times these catheters are very, very thin and they may get occluded with blood. So uh, to play it safe, we usually do not allow um, collection of blood from these samples because of the complications, and they have to be flushed, and of course has to be collected from a nurse. Many times you will not have time to wait for a nurse to come in and draw the specimen for you, so you might as well collect. um, you always want to collect centrally to the patient. For example, if the patient has a IV here on the wrist area, you have to collect above the site. Okay, if it's on the hand, above the site. All right, remember, never collect away from it because whatever antibiotics or IV fluids that they're receiving will affect your blood sample. Okay, so remember that. Even if you collect a specimen from an arm that has an IV and they're receiving fluids, obviously that IV fluid has to stop for at least a minute. Okay, when you collect your sample, you need to make a note of it. Blood sample collected from arm, patient receiving, such and such IV fluids. So that way the technologist that is going to process the specimen knows that if there is a high sodium level, high potassium level, it may be because of the collection of the collection site where you collected your specimen from. So just kind of remember that. And if you could, if possibly, avoid collecting samples from an arm that has an IV therapy. It's higher risk and more likely to yield incorrect results. All right. So when you do notice an IV site, an IV line, insert it into a vein. Again, avoid collecting blood from that site. Blood may be contaminated. So move on to another site if possible. Previously, active IV sites, avoid collecting sites where they had it before within the last 24, 48 hours, because if the IV was infiltrated, that means that there's still fluid around. Remember, we just talked about edema. If there you see a arm looks kind of swollen or big, you compare it to the other arm. If one is bigger than the other one, that's probably what happened. The IV infiltrated, and there's still a lot of fluid in there. So you don't want to collect it from there because it will contaminate your specimen. Central vascular access devices or indwelling lines, we call them uh, PICC lines or peripherally inserted central catheters or central venous catheters, usually here. Okay, and PICC lines are usually out here. They start in the antecubital or somewhere in here. They're inserted using a small ultrasound machine and by trained professionals. And they're used mainly for long-term IV therapy, long-term antibiotic therapy, and so on. So we have to allow the nurses to collect specimens for you from these sites. Do not do that. Uh, it's very easy, but again, it's not in your scope of practice. So you make sure that you don't collect specimens from there. You have your central venous catheters. They're inserted into large veins, so usually the subclavian veins, which is lies up here, okay, and goes into the vena cava and then into the heart. You have your small ports that I talked about, your porticas. You have your PICC lines that are usually over here. Again, it is not within your scope to collect specimens from here. Uh, Now we're going to discuss another topic. This is called, we're going to talk about patient complications. Patient complications and conditions. Now we'll be discussing patient complication and conditions because this is a very important aspect of your work. Okay, this is part of your the steps in the venipuncture procedure that we've been talking about and practicing already. So you have to make sure that you always ask for allergies. Again, this is a safety measure. You do not want to expose the patient to products such as latex or iodine, which the patient may have allergies to. So again, make sure that you ask about allergies. Allergies to tape, some people are very sensitive to plastics tape. So you might have to use the paper tape, which is called hypoallergenic tape. Um, Always place your gauze over the site. Have patient remove it, usually at least 15 minutes. Remember to instruct the patients to not lift anything heavy or bend their arm. Do apply pressure to the site for at least 5 minutes and leave the bandage on there afterwards. Allergies to antiseptics. Antiseptics are made of usually alcohol. So if a person has an allergy to alcohol, please make sure that you are aware of that. Latex, of course. Look for any signs indicating latex allergy. If the patient's arm turns red immediately, it's very important that you report that, make an incident report. Look for any signs in the patient's room or the door that tells you about any specific type of allergies or restrictions, such as no blood pressure to the left arm, no needle sticks to the left arm, and so on. To make sure that always use non-latex material and always ask because some gloves are made of latex, tourniquets, and other bandages. So it's very important that you ask about latex allergies. Patients with known allergies often wear special armbands. So also pay attention to any kind of armband that they might have next to their hospital ID band. It will give you any pointers about their allergies. Excessive bleeding could be a complication that happens usually because the patient is taking anticoagulants or aspirins, which is very common, and they usually tend to bleed a little bit longer than most people. So in this case, you will maintain pressure until the bleeding stops. Remember not to apply the bandage and the tape and forget about the patient. Once you instruct the patient to apply pressure to the puncture site after you remove the needle, you have to go back. You have to go back and check the bleeding before you actually tape it down. If bleeding continues more than 5 minutes, notify the appropriate personnel, usually the nurse or your supervisor, so that they are aware that if any complications occur, that you did make the right communication. Never apply a pressure bandage instead of maintaining pressure until the bleeding has stopped. Okay. Do not miss any and do not dismiss any outpatients or leave an inpatient until bleeding has stopped or the appropriate personnel have taken charge. For example, if you're in a hospital and the patient won't stop bleeding, please notify the nurses so they can take control of that and you can move on to your next patient. If it's in an outpatient setting, however, you have to stay there until the bleeding stops. Okay, you bandage the area, but I would also notify the physician so they're aware of the possible complications. Another possible complication that may occur during the procedure is fainting. Now, fainting doesn't occur often, but it can occur. So you always want to make sure that you ask a patient. Usually, I tell you to ask about history of fainting or history of fear of blood, fear of needles that may cause them to faint. Okay, fainting is a loss of consciousness, and usually their posture changes. Sometimes their blood drops. Okay, so fainting is usually caused by insufficient blood flow to the brain, and that's the only reason. That's the only thing that happens. Patients with a history of fainting are better secured in a lying position, okay, or in a reclining chair. You want to anticipate any possible complications, and you can do this by taking the necessary precautions, such as lying them down or using a recliner. In the chairs that do not recline, you might want to lean them forward as long as they have the resting front of it, okay, where they're not going to fall forward. Okay, this brings their head closer to the chest and allows them to breathe a little bit easier and recover faster. If possible, elevate the extremities to increase circulation back to the brain. Another complication that can occur is nausea and vomiting. It doesn't happen too often, but you have to be prepared for it. If a patient does verbalize or tells you that they're feeling a little bit queasy, like they feel like nauseated, right away you should discontinue the blood draw until it goes away. Give the patient right away a wastebasket, a plastic bag, or something where they can vomit in case they do continue with the nausea and end up vomiting. Okay. Meanwhile, you can apply a cold or a damp washcloth to the forehead because they may start sweating as a reaction of the nausea, and you want to. It does kind of help to make them feel a little bit better. So again, be prepared for somebody that might have nausea and vomiting. If the patient's nausea or vomits and refuses to does not want to continue with the procedure, obviously you have to inform the appropriate personnel, especially the physician who might be awaiting the results of the specimen. They might ask you to reschedule or have them wait a little bit longer and maybe try once again if the patient agrees to it. Now, pain is something that will be experienced during the venipuncture procedure, and we expect minimal pain, and we try to keep it to a minimal. But do warn the patients, tell them before the needle insertion that they're going to feel some pain, but you're going to keep it to a minimal. Do never tell them that it's not going to hurt, because it does hurt, and they may be mad at you, or they might overreact when you insert the needle into the skin. So avoid excessive, deep, blind, or lateral direction of the needle. Some people call it fishing. When you go into the vein and you are right next to it and you try to redirect and go lateral, side to side and back and then to the other side, and you're just kind of probing around, and all you're doing is looking for trouble. All right, you might be close to a tendon, to a nerve, and you might cause excessive damage. And here's where the liability increases the risk. Okay, so make sure that you don't do any excessive or deep blind or lateral redirection of the needles. It can cause severe problems. If a person complains of extreme pain or numbness to the area, maybe they feel like an electric shock running down their hand, you might have poked a nerve. Okay, remove the needle immediately, apply ice, and of course document the incident, because it may come back in a couple of months. You may be um, served with a lawsuit because of possible damages to the hand or injury. So again, blind probing around is not recommended at all. All right. Something else that you might encounter, and it's kind of rare, is a petechiae or petechiae, however you like to pronounce it. These are very tiny, non-raised red spots. It almost looks like an allergy reaction, but it's not. These are actually capillary beds, okay, that sometimes they bleed, okay, the little spots, okay, they appear in an arm when the tourniquet is applied. So if you put on the tourniquet on there and you see little pinpoint dots all over the place, these are called petechiae, okay? And it's nothing that you caused. It's just that the person's capillaries are very weak and they start to form these little dots. Another possible complication that you might encounter during your venipuncture procedure is seizures or convulsions. All right. Usually, when you're going to perform a procedure on a patient and you're talking to them, they might tell you that they have experience, or they have a condition with seizures, right, or convulsions. Now, in this case, you're going to have to be prepared for it. As you know, seizures are uncontrollable electrical activity in the brain. So what happens? The person loses consciousness. Okay, they may not respond or react to your voice commands. They don't last very long. They usually last less than 30 seconds or a minute. However, if somebody does start seizing, okay, they're not fainting. When people pass out, usually they see black and then they collapse sideways, forward, or whatever. A seizure, usually their eyes may roll back, okay, and they will not respond to verbal commands. So discontinue the procedure right away. Hold pressure over the site without restricting their movement. Remember, sometimes if the patient has convulsions, they may be moving their arms back and forth, and they may injure themselves. So if they do tell you they have history of seizures, they're best served in a bed, or at home it would be in their couch or a reclining chair. But you have to make sure that their arms do not get stuck anywhere within the chair. Right? Anything that restricts movement of their limbs while they're having a seizure can actually cause injury. All right, so do not hold pressure over or do not restrict the patient's movement. Allow them to have the seizure. Do not put anything in the patient's mouth. Never insert anything in the mouth. They're not going to choke with their tongue. They're not going to aspirate. Okay. Protect patient from self-injury. Sometimes the head may be moving. They may be convulsing in the head. You can try and protect the head as much as you can by applying a piece of cloth, a pillow, or something there. Again, this is before you actually start the procedure. Okay. Sometimes the stress of having a procedure done may cause the onset of a seizure or convulsion. So just be careful and be prepared for it. Okay. Notify first aid personnel. There's nothing you can do to stop a seizure, but there's a whole lot that we can do to prevent injury from a seizure. All right. So it's important that you know how to handle patients before they have a seizure. There are some procedure errors or risks that we can cause, okay, inadvertently. Obviously, we don't do things on purpose, but a hematoma formation. We talked earlier about hematoma formation. A hematoma is a collection of blood under the skin that becomes very, very sometimes hard, and it starts to create pressure. Okay, if you see blood spilling around underneath the skin, like a lot of bruising, starts to go around the puncture site, stop the procedure immediately and apply pressure for at least 2 minutes. Okay, because when you insert the needle into the vein and you go right through the vein all the way across, you made another hole on the bottom. So when you pull the needle back and you start to see blood come into your tube, right, and you're collecting your tube, the blood, the hole that you made on the bottom of the vein on the other side is still leaking. So what happens sometimes, they'll leak very, very quickly, especially for patients that are taking anticoagulants. They're going to start bleeding and they're going to have a big, big hematoma, or it looks like a big bruise. But I want you to know the difference. Bruising is just discoloration or bluish discoloration. Hematoma is actually blood pooled under the skin, which will cause pressure and pain, and even nerve damage in some cases. So apply pressure for at least 2 minutes. Offer cold compresses or ice packs to reduce circulation to the area to minimize the bleeding. Okay, again, this is considered a serious complication that may require even surgical intervention if it gets that bad. If there's a lot of blood pooled under and is causing pressure and pain, a doctor may have to go in there surgically and remove some of that excess, that coagulated blood, to remove the pressure and the pain. But again, this is a serious complication, so be very careful with it. Another complication that occurs, and it's not intentional, obviously, is called iatrogenic anemia. You have to make sure that you know what iatrogenic anemia is. Anemia, obviously, is a low red blood cell count. Iatrogenic is self induced or caused by healthcare personnel. When somebody develops iatrogenic anemia, it's usually caused by healthcare providers. Okay, it's brought on by the blood loss from too many blood draws. Too many blood draws. A lot of patients go to the doctor, and then that doctor sends to another doctor, and they get blood samples every doctor they go. By the time you know it, this patient is looking pretty pale. Why? Because of the amount of blood draws that have been collected from one doctor and another doctor. All right. So you cannot exceed more than 10% of the blood volume at any point. Never more than 10%. If you have 5 liters of blood, okay, in your body, we cannot collect more than 500 mLs, because it might actually cause serious reaction, shortness of breath, and serious reactions to your heart, okay, and to your organism. So you should never consider more than 10% of blood volume. Again, an example is 5 liters. 10% of 5 liters is 500 milliliters. So make sure that you never get that much blood drawn at one time. We usually only collect minimum required specimen volumes. So most of the tubes are 3 to 5 mLs. So that is all we need. And now another possible complication is inadvertent arterial puncture. And this is can happen usually when you try to puncture the, the areas in the wrist area where you have your radial pulse. If you have a pulse, you have an artery here. You have an ulnar artery here. You have your basilic artery here, which runs around here. Remember, because we have a pulse here. So you might accidentally puncture them. What happens? Sometimes if you go through the artery, they're going to have bleeding inside the arm, causing a hematoma. The blood fills very quickly. It's because you punctured a hematoma. You punctured an artery, and you may cause a hematoma. This is a serious complication. So you have to make sure that you report it and document it if this should happen. Hematomas can also, we can also cause infection. All right, this is rare, but when we collect blood samples, we are piercing the skin. We are introducing, of course, sterile equipment. However, there is bacteria in the skin, and it's going straight into the bloodstream. So a person may develop an infection. Okay, we can avoid this by limiting or practicing, right, antiseptic measures like washing your hands, using antiseptics, using gloves. Okay, uh, using your tape bandages. Brand new. Do not put the tape on the table or on the edge of the table or anywhere else. You don't need to do that. Okay, so by preparing tapes or bandages ahead of time, you're actually bringing contamination to the site, and you're going to introduce it to the puncture site, therefore increasing the risk of the patient developing an infection. Preloading needles on tube holders, again, that's also you're opening the needles before you use it, can also increases the chances of you introducing infection. Don't touch the needle insertion site after you clean it. Remember, you cannot go back and contaminate it. Once you clean it, you should not go back and palpate it anymore. Minimize time between needle cap removal and venipuncture. So once you remove the cap, inspect the needle, make sure it's not blunt, and right away you go in there and insert the needle into the arm. Do not expose it to the environment. Remind the patient to keep any bandages on for at least 15 minutes after the venipuncture site, because the blood clot is forming there. It keeps the puncture site closed, free from contamination or infections. Nerve injury. Nerve injury is, of course, a serious complication. It's caused by improper site or vein selection. As we said many times, you do not want to collect a specimen from the basilic vein, because you are increasing the risk of probing or poking the nerve that controls the distal part of the hand and the distal part of the arm. Okay, if you injure this nerve, you will cause something called a claw hand. Okay, you puncture the ulnar nerve, the one that goes here. Okay, and some of the fingers will contract like that, making it look like a claw. Okay, so make sure that you don't probe around there or do perform blind probing around that site. It's not necessary. Excessive lateral redirection, going side to side, back, and then to the other side, that's blind probing, and that is completely unacceptable. If initial vein entry is unsuccessful, use slight forward or backward redirection of needle. Okay, just come slightly back, very slightly, right? No lateral going to the sides, right? Just slightly, and try to anchor that vein. Make sure it doesn't move so that you are successful in accessing the vein. Reflex or anticoagulant, okay, of anticoagulant. Now there's some tubes that have anticoagulants, okay, all your EDTA tubes, right, your sodium citrates and so on. This chemical can go back into the patient's arm, but you can prevent it simply by lowering the arm. Instead of having a horizontal plane, go ahead and lower the arm. So when the blood does come into the tube, it fills from the bottom up, right? If you have a horizontal arm like this and the tubes is this way or horizontal, what are you doing? You're actually making contact with a chemical, and the blood is right there very close to the needle, which can cause the blood to flow back into the vein, causing reflux. So very important that you do not cause this, because the patient may develop an adverse reaction, right, to the chemical. Keep the arm in a downward position and the tube below the venipuncture site. Rarely do we cause vein damage, but it can happen again after repeated numerous puncture sites. Over time, many patients get blood drawn over and over and over again, and you're gonna notice that some of the veins develop like a little ball, like a little bump, and that's because it's scar tissue after many punctures, right? And patients actually continue to ask you to puncture them there, because that's where they always get it, right? Especially those that are difficult to collect. Okay, the difficult draws. They tell you, this is where you get it, and you notice they're gonna have like a little bump. That's scar tissue that developed over the vein. Avoid blind probing. Okay, improper techniques. Stick to the guidelines, and you will be fine. But once you start doing your own thing, uh, s- you know, um, going away from the guidelines, that is when you're opening yourself up to risk and liability. All right, so we continue our conversation on chapter 9, pre-analytical um, errors or considerations. And we have to discuss a topic about the specimen quality concerns, because a lot of the specimens are rejected mainly because of a couple of reasons we're just about to talk about. Okay, so when you bring a specimen to the lab, okay, and is rejected, you're going to be asking yourself why, when they tell you you have to recollect and recollect, and you're going to get frustrated. So by simply knowing or being aware of the possible things that can happen because of the lack of technique or proper technique, okay, you are going to save yourself a lot of time and frustration. Okay, you're also going to be saving the patient's time, money, and their delay of treatment. All right, so please be very aware of these possible things can happen. I've talked about several H words. I've talked about hematomas. Okay, I talked about hemolysis, hemoconcentration. So here is where you have to be aware of these. Okay, so one of the quality concerns is hemoconcentration. What causes hemoconcentration? The most common reason is dehydration. Okay, a decrease in fluid content of blood. If a person is dehydrated, they have less fluid in the body. So when you collect a specimen, it's going to be a little bit thicker. It runs down a little bit slower. So this may be a possible cause. So we don't want a concentrated specimen because it's going to yield inadequate results. Some of those blood electrolytes, okay, that are there in the serum and the plasma, they're going to be elevated. Okay, so think about it. Think about the example I gave about a glass of water. Okay, a glass of water, it's completely full, and you put 10 teaspoons of sugar. Okay, and then you decide, you know what, I'm just going to take out some water. Okay, so you take out water, and now that glass is going to be more concentrated with sugar. It's going to be a lot sweeter. Okay, so any changes or decrease in fluid is going to alter the results of the specimen. Okay, so hemoconcentration, an increase in non-filterable large molecules. Okay, some molecules are like your sugars, okay, your proteins and so on, that are not able to be filtered out of the blood. Okay, can be uh, as a result of hemoconcentration. Okay, can be caused by the stagnation of normal venous flow due to the tourniquet. So when you apply your tourniquet too long on the arm, okay, you're limiting the blood flow. Okay, remember, the purpose of the tourniquet is only to slow venous return, not to restrict. Okay, you don't want to restrict arterial flow. If you notice that the patient's arm is getting a little bit reddish or purple, then you probably have applied that tourniquet too long. If the person tells you my hand is tingling or feels numb, you've had that tourniquet too long, you know that you should not apply the tourniquet for more than 1 minute according to the venipuncture procedure. All right, so again, please make sure you're aware that if you do, then you will be causing hemoconcentration. All right, hemolysis is another H word that we need to be aware of. Okay, hemo means blood, lysis means breakdown or destruction. So how can you possibly destroy your red blood cells? Well, very easily. All right, by performing vigorous shaking. Okay, when you get your specimen and you do it too hard or you shake it like that, you are actually destroying the red blood cells. Those red blood cells will spill into the serum and the plasma when they are centrifuged, and we call what they call a hemolyzed specimen, and it's going to be rejected. That's probably the biggest reason why specimens get rejected, because of hemolysis. Okay, so hemoglobin escapes into the fluid part of the specimen, which is your serum or your plasma, and therefore yielding a hemolyzed specimen that will be rejected. Okay, tubes that are partially filled, okay, can also be rejected. Remember, especially if you bring tubes that have anticoagulants such as your sodium citrates, the blood to additive ratio isn't correct, is going to be rejected immediately. All right. Remember, there is a line that tells you the fill line. You should make sure that you fill that specimen tube until that line. All right. Specimen contamination. It doesn't occur often, but it can, right? If you're going to perform a procedure and you do not allow alcohol to dry air by itself, okay? Some of that alcohol residue may come into the specimen and, affect it. Fingerprints, powder from some gloves, baby powder if you're collecting a specimen from an infant, in their bassinet, any urine or anything that is inside the bassinet can possibly contaminate your specimen. If it's a heel specimen, which will cover in capillary punctures, anything that is around in the bassinet will contaminate your specimen. Getting glove powder, blood films, dripping, you're sweating, coming into your blood specimen, obvious contamination. Following proper antiseptic procedures, such as not washing your hands or sanitizing your hands before the procedure, and using the wrong antiseptic. There'll be at times when you cannot use alcohol. There'll be at times when you cannot use iodine. So if you're collecting an alcohol level, obviously you cannot use alcohol to cleanse the site. If you're going to be collecting trace minerals, you probably won't be able to use iodine. So please make sure you follow the guidelines for specific tests. All right. Now, using wrong or expired collection tubes. Obviously, this is a very easy to determine. You should not never be using wrong or expired collection tubes because number one, they will have less vacuum. You will not be collecting enough specimen. Okay, and collecting, using the wrong tube for the wrong test, obviously, is going to be rejected. So be very, very aware of that. The tube position. We talked about inserting the tube into the tube holder. Okay, make sure that when you push it in, you can do a twisting motion so that the tube goes in there. Okay, so be very aware of that. If the needle fails to penetrate the stopper, there will be no blood flow. Okay, make sure that you stabilize the tube holder when inserting the tubes. All right, when using the ATS system, very important. Remember to troubleshoot failed venipuncture. The important steps: you always stop, assess the problem, and make the correction. Okay, make sure that you do not perform blind sweeps. Look at the needle position when you're looking at trying to recover a vein. Okay, is it too far? Are you too far in? Are you not far in enough? Okay, is the bevel partially sticking out of the skin? If that is the case, you'll probably have to start again. Is the bevel partially into the vein? So when you insert the needle, okay, you can only imagine. Okay, say this is the vein, okay, and the needle goes in. Sometimes the bevel may be partially in, sometimes maybe way all the way through. You retract the vein and come the needle and come back into the vein, and you might get blood draw. Sometimes you go right through it, through the side. Okay, so just kind of take a step back and evaluate the process, okay, and make the correction if needed. The bevel is a very important part. It's the one that goes into the one that pierces the skin when you insert it. All right, so make sure that that bevel is facing up and it is in the vein. Okay, as long as you anchor the vein correctly using the L method, you should be fine. Okay, again, it takes practice to become very good at needle punctures. So don't be discouraged if you have troubles in the beginning. All right, there's a lot of issues that can happen during the venipuncture procedure, but again, we try to correct them whenever possible. The needle position, correct needle position, usually the blood can flow freely into the needle, as you'll find out. If the needle is not inserted far enough, especially when a patient is obese, you may not be going deep enough, so you can continue to proceed further in. The needle does not enter the vein, you will not have any blood flow. So for that problem, you have to insert it just a little bit more. If the needle bevel partially out of the skin, okay, the tube vacuum will be lost. So when you try to recover a vein and there is a little bit of blood comes into the tube, okay, you say you try to pull back out, thinking that you're too far in, and the bevel comes out of the skin, the vacuum is lost. As soon as you remove the needle from the skin, the vacuum is exhausted, so you have to start again. If the bevel, in case partially into the vein, causes blood leakage into the tissue, so you start to see a little bit of blood coming under the skin, and that's what could happen, right? Because you partially penetrated the vein, right? It's partially in, so the blood will seep out, out to the skin, and you see this bruising starting to form, or hematoma, okay? If the bevel is completely through the vein, there is no blood flow. There usually, and you can easily tell when you went through it because there's no blood flow, and you can tell that a lot of the needle has gone into the patient's arm. Okay, you're probably too far. So slowly come back. Okay, slowly come back, and until you see blood return. If you see blood return, all right, and try to make the readjustment if possible. And remember, do not do any blind probing or side to side probing. That is not acceptable. The needle bevel against the upper wall of the vein prevents blood flow. All right. So when you insert the vein, especially in the antecubital area, okay, if the arm is bent a little bit, you might have the bevel end up hitting the top wall of the vein and getting blocked, and you might not get blood return. So try to make sure that the patient has a straight arm, and if that you see blood flow, then that was a problem. If not, you might have to again come back out just slightly, very slightly, without taking the needle out. Sometimes the needle bevel is against the lower part of the vein, and this is usually if you insert the bevel facing down, which you shouldn't. Okay, it should be always be facing up, not down. Again, this could be caused by the wall of the vein or the bevel being against the wall, lower part of the vein. The bevel penetrates a valve, preventing blood flow. This could happen usually on the veins of the hand when you insert when you're palpating a vein, okay, and you feel or you see little bumps or like little bumps on the vein, that is actually what we call a valve. This valve prevents blood from going back this way. Remember, venous flow is towards the heart, okay, and if you see a little bump in a vein, that is a valve. You should avoid puncturing the vein at that side. You should maybe go away from it distally, or maybe more on the upper arm, right over it. Okay, but never close to the valve, because this will probably not allow you to collect any blood specimens, and you will probably damage the valve. Okay, so make sure that you don't poke anybody close to a valve. The needle besides the vein. This is very, very common when we do not anchor the veins properly, or the veins roll to the side because we didn't anchor correctly. You're going to be right beside it. Okay. Or maybe you palpated the vein, going in a certain direction, and you inserted the needle straight, okay, not with the direction of the vein. Then you're going to see that you're going to be right beside it. You're going to miss the vein. Okay. And sometimes when you release the vein, when you unanchor it, you're going to see that the vein comes to the side and your needle's right there next to it. It happens very, very often. This is very common when we do not anchor the veins correctly. Even if they don't roll, it's always best to anchor the veins, okay, because they might have very slight movement when you insert the needle into the vein, right? The needle will push the vein, and the vein will move slightly, and your needle's going to be right next to it. Okay, so it's important that you always anchor the veins, and you can prevent, again, missing the vein by anchoring correctly. A collapsed vein prevents blood flow despite correction of needle. Sometimes your blood flow will stop. It will come to a complete stop. Okay, why? Because the vein collapses. When do they collapse? Remember that you're going to select the equipment necessary to, depending on the condition of the vein and the patient. So if you have a weak dehydrated patient, the veins are going to collapse because of the vacuum in the vacuum. All right, so you have no control of it. So what will you do? Well, if you notice this right away, then you should make the selection of the appropriate equipment by using a 10 ml syringe, 20 ml syringe, where you have more control of the vacuum. All right. So if the patient has very small veins, again, they will collapse with the amount of pressure from the vacuum. So you make sure that you collect a syringe using a syringe method. So you try to troubleshoot failed vein punctures as much as you can when the vein walls draw together or they collapse, okay, caused by the vacuum or the plunger. If the plunger, if you use a very small syringe and you try to collect like that, the plunger will pull the vein and it will completely close, and therefore you will not be collecting any blood from that patient. The tourniquet is too tight or too close to the site could also cause the veins to collapse. The tourniquet is removed during the draw, might completely stop the blood flow. Again, we can leave the tourniquet on until the last tube. If the person has a very slow blood flow, you can leave it there, especially with the elderly people. Tube vacuum. Tube vacuum. When you have a tube that you suspect maybe it doesn't have enough vacuum, or it started but then it stopped, go ahead and try another tube. Just have extra tubes handy in case one of them does not have. The loss of vacuum due to bevel partially out of the skin. When you insert the tube or when you're handling the tubes, put them in there. What can happen is that your needle might accidentally move, okay? And it happens very often if you don't secure the tube holder to the skin, to the arm. When you insert the tube, okay, you may accidentally move the needle and it may come out, and you will have uh, no blood come out, or you may lose the vacuum. So that is all we have for chapter 9. We covered a lot of ground in this chapter. Again, it's very, very important topic so that you know how to prevent complications. We talked about the different complications, including the fainting, nausea and vomiting, seizures, fear of needles, etc. So it is your job to understand what the possible complications that can happen to take these into consideration when you're going to collect a specimen. How is my technique going to affect the quality of the specimen? Is it going to be rejected? So you have to again adhere, follow the guidelines as far as specimen collection is concerned. The venipuncture procedure, you must follow it as is and not stray away from it where you're going to cause some possible complications. So again, please go back and practice, practice, practice. That is what's going to make you a good phlebotomist out in the field, and you will be able to go home with a peace of mind that you did something good for the patients, that you're contributing to the care of this patient. And again, never seem too rushed when providing care. Take your time, but at the same time, be efficient. All right. You do have to collect a certain amount of specimens that is expected of you, but always know your limitations. If you have difficulty or trouble with certain types of patients, then you might as well ask somebody else to collect it and maybe exchange another patient for them. So we talked about a lot of the criteria uh, to select a suitable site, right? Vein selection, we talked about that. Um, some of the substances that can interfere in your specimens, such as medications, blood constituents, exercise, diet, and all those possible physiological causes. And there's so much that we can learn from this chapter. All right. But again, it's take it very seriously because the results or that you produce will yield the results of the patient. They're waiting for your blood specimen collection so the doctors can treat the patient accordingly. So again, you have to be very um, effective, very efficient, okay, and very accurate. Phlebotomy should not be taken lightly. You're just another part of the team, and your work is just important as anybody else's. So good luck, and we'll see you on the next chapter.